Hi everyone, I am Tudu Edzo.
Hi everybody, I am Marcia and we are the brains behind We Nurse You.
So I'm a healthcare professional, I'm a professional nurse, and I have been in the industry for about more than 10 years now. I have a diploma in nursing. Well, I did a diploma in nursing, then I did a degree, and I also have specialty in administration, that's your management, and education as well. Yeah.
And many other courses.
Yeah, and many other courses. And many other short courses, because remember, even in our field, we have different things that we need to specialize in. So we've got different certificates with regards to what we're working on. And Masha also has hers as well, which are different to mine.
Yes, so I've been in nursing also more than 10 years now. I did the 4-year diploma in nursing with Chris Hani Baragwanath Nursing College. We at Barra.
And I'm from Enletsky, representing.
Yeah, so and then after that, I did my postgraduate diploma in HIV and AIDS management. And then, as Tudu has just said, there are many other short courses that we did. And then we are both NIMARC trained and certified, IMCI trained and certified, and others, you know. So we have been working. I've worked in the hospital before, at Chris Hani Baragwanath Academic Hospital, the biggest hospital in the southern hemisphere. Okay. Yeah, so I worked in the maternity theater as a scrub nurse, as a midwife, and then at some point I was in the pediatric ward. Excuse me, ward 36, and high care. So yeah, then from there I moved to the primary healthcare facilities, which is where we met.
That's where we met.
Yes.
So I've been, after my ComServe, I've been in the clinics like ever since, you know, so that's what I wanted to do. And we met in one of the clinics that I was working in. So she found me there, and I remember her working in the clinic. And she was coming to assist my area anyway, so I was like, oh, thank God somebody's coming. I was overworked, overwhelmed and everything. So as she was walking in, and I saw this lady, and I looked at her, I'm like, this one, she looks like my sister, you know. And she came, I'm like, hey, go here, matey. You know, I've been waiting for you. Waiting for you coming to me.
Yes.
And that's just how it happened, and we started working together. In the mother and child area. So that's where we did your pregnant women, your family planning, your IMCI, where we're immunizing children, seeing your sick babies as well, and incorporating HIV in the midst of all of that, and TB. Yeah. So yeah, that's where we met, and we started, which year was it again in COJ? We'll tell you.
Yeah, I don't remember the year, but yeah, that's where we've been working.
Then
from there, we then moved to an NGO world. We worked for one of the NGOs, so in Ekurhuleni though. And then, yeah, so we've been there. So over the years, this is where we realized, there are so many mistakes and so many information or gaps, misinformation that's going around that our people are doing. And we wanted to share that knowledge, and we wanted to rectify some of these mistakes. So our program, or our show, our page is going to be about that. So it's the patients, it's the nurses, with the healthcare professionals. It's more of how to deal with some of these issues. And then with our clients and with the general public, it's just for information sharing.
Yeah, and also, you know, when Masha mentioned that certain things that we're not doing, remember when you go to your public facilities, you find that there's staff shortage, the patients are too many. So there's certain information that will be omitted during that period. So we want to make this a platform for you to get that extra information. And I know a lot of people are Googling as well. So when you have this platform, then we'll also give you an opportunity to even ask questions. We can interact with you. So it will just be a blast. But we are here to give you all the information that you need.
Yes. So we can't wait.
Yeah,
we can't wait. Yeah.
So one of our specialities currently in the NGO setting is your HIV and AIDS. So we're going to be giving you information galore, and we want to incorporate it in each and every thing that we're doing. In pregnancy, we're putting it in children, we're putting it in, just going right across, because it's quite a big problem in the society, and we want to make sure that we are taking care of our health with HIV, without HIV, just that.
Yeah, so isn't it, we said we'll be focusing on pregnant women, so it's the mother and child program as a whole.
Yeah.
So from pregnancy to delivery, to when the child needs to get their immunization, when the child is sick, your contraceptives, all of that. So we even the daddies are welcome. So we'll be incorporating every single thing. And the reason we are also including HIV and TB is because, just as Dudu has just said, HIV and TB are one of the biggest problems that we are facing as a society, as a country in South Africa. And unfortunately, it affects everybody, whether you're pregnant, whether you're a child, whether you're male or female. And unfortunately, because there's still so much stigma around it, we are unable to share this information openly, individually. Some patients are afraid to ask, and some questions can be brought in anonymously, or you can send us through, or maybe there'll be a time where we'll be having live sessions, and then if you also want to be part of the show at some point, we'll have a podcast, and then we can have specialists come and speak to us about some of these issues. We can have some of the clients that are living openly with HIV, or those that just want to share their experiences. And we are mainly focusing on the public healthcare sector, because this is where we work, but we are not excluding the private sector.
So we're also giving them a lot of information because they work independently. So with the people that we're going to invite, there are people that we're going to holler at, and then there are people, if you feel like you want to be on the show, you can also just give us a ring, give us a message, send a DM, or whatever the case may be. So we'll be inviting specialists as well. So people who are specializing in the field, they will give you detailed information as well. So yeah, that's it.
Part of the show will also be, will also include us giving announcements about what's happening in the healthcare sector. For instance, if there's a new drug that's being introduced, things like your CCMDD, which we know that a lot of people are not aware of, or they are, but they don't know what it's called. So there's quite a lot and a number of things that we'll be talking about. So please feel free. And if there's anything specific that you would like us to discuss or to talk about, you can also holler at us. Our Instagram page.
In 2019. Yeah. We founded it in 2019, and because a lot of things have been happening, we could not really upload a lot and stuff, but right now we're on it. This is our brainchild. This is what we've always wanted to do. We wanted to serve. This is us serving the community, so you also see a lot of activity happening on that page. We're gonna have lives, like Marsha has said, and open other pages as well, like your TikTok, your YouTube. We're gonna be there. Another thing is we also want to touch a lot on mental health, because this is something that we're all struggling with, well, it's our everyday life, how we're managing ourselves on our daily routines, workspaces as well. So we'll be having even teachers on the show who are coming in, psychologists. We're watching, we're looking out at some of you. So we'll be having all of those people coming to assist us on the show. So it's not just going to be generally about health and sickness and all of that, but we're going to incorporate a whole lot of different things. So our main aim is to have a happy and a healthy lifestyle, and how to manage it.
Yes, definitely. So Page was founded in 2019, but because of COVID and many other things that happened after that, we could not carry on with it. But we're back with a bang. So yay. So this is our our page, our Instagram page. Please follow, like, and comment on the page, and then you can also send DMs of
Follow.
whatever that you yes, definitely follow that you're going to, that you would need us to discuss. And then the other social media platforms will inform you as and when we open them, whether it's YouTube, TikTok, and Facebook, just as Tudu has just said. Yeah.
So we're looking forward to having more interactions with you and giving you more information, sharing information with you, and just enjoying this page. So,
and learning a lot from
learning a
you
lot,
guys,
yeah.
because there's definitely so much that we can learn from the public, from our viewers, from our followers, from our clients. You know, we want to know your experiences in your different lines of work or wherever you are accessing healthcare, and then we can learn from one another in that manner.
And we're also going to share our experience, because I mean, we've been in the community a lot. She's been in the hospital as well. I've spent my time in the community, so there are a lot of things that we have seen, experienced, and yeah, we'll see.
Yes, can't wait to see you guys. So don't forget to like and follow us or our page, and then we nurse you. From the nurses that nurse and love you. Ciao.
Bye.
Bye.